This year's ASH was pretty interesting because we've been hearing about certain early phase technologies that are being utilized in clinical trials in other diseases, and they were coming into myeloma now. So there is more mature early phase data with the CAR T cell technology targeting BCMA in myeloma. We also had some really interesting MRD analyses that were presented in prospective trials that are relevant to the clinical practice today. So the IFM Dana-Farber 2009 study reported on the final MRD analysis, looking at the 10 to the minus 6 power, having the most prognostic significance for progression-free survival in newly diagnosed transplant-eligible patients. We had Dr. Bruno Paiva present data with flow. There were data with MRD NGS that were presented in a similar theme. There were also a number of studies presented with daratumumab combinations in newly diagnosed setting, smoldering myeloma, as well as in early relapse setting, which hold quite promise. In fact, I believe Alcyon study, which was daratumumab VMP compared to VMP in the frontline transplant eligible settings, was a late breaking abstract this year showing better depth of response as well as progression free survival benefit. We'll still have to wait for the overall survival benefit, but these results were fairly compelling with a low hazard ratio. So overall, we had a lot of interesting abstracts. We also had some transplantation abstracts of note. The EMN02 trial, which had CyBorD as induction followed by single or double transplants. There were compelling data giving a hint that perhaps tandem or double transplants may show benefit for stem cell transplant eligible patients who have high-risk disease. It's a small subset of that particular trial, and the trial wasn't really powered to answer that question, but still provides a good hypothesis that may be tested. The Total Therapy program in Arkansas already did that, and without a lot of success for high-risk patients, but perhaps the novel agent inductions and novel agent maintenance post-transplant, tandem transplant may be the difference between that experience and the EMN02 experience.